As we speak, people are dying of AIDS. Millions are dying. There is still 6 million in Africa waiting to start treatment. It means they will deteriorate, they will get ill, and they will die.
People today, despite all the money that's going into the health sector, all the funding, all the initiatives that are underway, are still not getting medicines that they need. There have been definitely gains in recent years, but it's not enough. So the question is, why aren't people getting the right medicines at the right time?
The HIV crisis is still far from over. In 2009, 2 million people died of HIV-related diseases. Close to 60% of those in need of treatment are still not getting it.
There's lots of different reasons why people don't get access to medicines. Patents are one reason, there's others. There's policy, there's distribution systems. Yeah. Are we building sustainable pharmaceutical systems? Are we dealing with the issue of corruption? What's actually happening on the ground?
Right now, research into new drugs is encouraged by the promise of big profits that can be made from selling the drugs once they are developed. But 90% of children with HIV live in sub-Saharan Africa. These 2 million children are never going to generate the big profits that would mean big investment in treatments for them. So right now, there aren't enough suitable drugs, and half of these children won't live to see their second birthday.
Big Pharma is basically the 5 to 10 giant drug manufacturers who collectively control much of the world's drug production. There's a lot of really big issues, ethical, moral, criminal issues with Big Pharma.
Big Pharma right now is under threat in terms of their whole business model, and they're trying to hold on to a lot of their old ways.
For the first decade, Big Pharma played hardball and made it very difficult to get the drugs out to the people, and thanks to a number of very bold steps by South Africans, Brazilian and Indian generic drug manufacturers, there's been a tremendous positive change. South Africa did a lot of the heavy lifting when they fought the Doha round and the TRIPS agreement, in which Big Pharma insisted on everyone paying top dollar for their on-patent drugs.
Once you get companies competing for the same product, you'll find that prices really do drop.
And there's been fantastic changes in availability. For example, it used to be $10,000 US per patient per year, and now many African countries are providing drugs at a rate of under $200 per patient per year.
The cost of HIV drugs has dropped enormously. Not long ago, treatment was something which was only available to the wealthy. But now, more than 4 million people around the world are being treated with antiretrovirals, or ARVs, an effective form of treatment that allows HIV patients to live a long and healthy life.
What's great is that there's a lot of creative thinking going on right now in terms of how do we deal with a lot of the contentious issues, what are new ways of thinking, how do we create the right incentive structures to get companies to do what we want them to do in terms of helping get drugs to people that need them. If you look at companies in emerging markets, so you look at BRICS, the Brazils, the Russias, the Indias, the Chinas, they're, the type of growth is absolutely dynamic. And I think some of our traditional big pharma companies are going to be under threat from some other types of companies that they haven't traditionally competed with. So I think it's an exciting time, and it's important to kind of look at the pharmaceutical industry right now as under complete flux and shifting and change to see what actually pans out. So again, I think we really have to sit and look back and say, what are we doing that we've been doing for an awful long time that isn't actually making a difference? We're just getting the same results. So I think we need to have breakthroughs, and breakthroughs will demand some pretty radical new ways of thinking about things.